first story, healthcare IT news, actually any outlet that you can find today is talking about Atul Gawande to lead Amazon, Berkshire Hathaway, and JP Morgan Chase Venture. I wish they'd give it a name. We just keep, having to say Amazon, Berkshire Hathaway, JP Morgan Chase Venture. We know a lot about Atul Gawande. He's known in healthcare. He's written some great books. He really exposed, fee for service and the challenges of fee for service way back in early 2000s. Actually, 2009, I think, is around the time frame he really exposed it during that debate. He did some really good research and wrote some good articles. He's also talked about end of life, that topic that people just tend to shy away from, and really addressed it in his most latest book. So he is really a maverick, sort of a, he likes to push the boundaries. He likes to really address things with a data-driven approach. It should be interesting, but I'll give you the first pass on this one. First of all, any thoughts on the selection of Atul Gawande to lead it, and any thoughts on the promise of the venture itself?
Yeah, a couple things. Obviously, he's an outstanding individual who really understands some of the issues and the challenges in healthcare. As you said, he's written some great articles, great books. I think he's going to be a very good selection, or is a good selection. I think he'll do a really good job of helping those organizations understand where the opportunities are, especially with their populations, and how they can better manage the health of their employees and work with the payers and the providers to really, kind of drive out some of the unnecessary cost. And I think, as you said, he's always been kind of a guy who's out there and not afraid to challenge the kind of status quo. So I think he'll be good, because he'll be a person who's thinking about things that are maybe a little outside the box. It's going to be interesting to see what that venture really does, beyond what they're going to do with their own employees. What can they do to really help transform healthcare? I think that's the big challenge. And even for him, it's easy for people to identify what the issues are. The challenge is, what do you do about it? And this is not an easy industry to really, make significant changes in. So I think the real key will be to see, what do they do beyond just their own organizations to really try to influence healthcare? And can he actually help implement some things that could help others transform the industry? That's really the challenge. I mean, we have a lot of people out there that really, can talk about what the issues are. It's then, what do you do about them? That's really, I think, the challenge.
Yeah, I agree with you. I love this. I love this selection. And I've been talking to some people about it earlier this week.
Yeah.
And so here's the things I love about it. One is, he's an insider, right? So he's a physician. He's been in the OR. He knows just about everybody in the industry. He can call up leaders at Mayo and go visit their Stanford. He could call either of us up tomorrow, and obviously we'd meet with him. He is an insider. We all appreciate his skills, his background, his insights. The other thing is, he does rock the boat. So when I came into healthcare, one of the articles I was told I had to read was the cost conundrum: what a Texas town can teach us about healthcare. It was in the New Yorker on June 1st, 2009. So this is right when the ACA was being waged. And here's just a couple of things that he said. So, here along the banks of the Rio Grande, the square dance capital of the world, talking about McAllen, Texas, the medical community came to treat patients the way subprime mortgage lenders treated home buyers, as profit centers. So he really attacked this whole fee-for-service model. And at the time, what he had done is, he'd done it and done all this research on the data. And what the data said was that McAllen, Texas was charging way more. It costs way more to care for the Medicare population than, say, El Paso, Texas.
Right.
And he had that quote. He went on, says, when you look across the spectrum of Grand Junction to McAllen, Grand Junction being a great example, McAllen being the poorest at that time, and the almost threefold difference in the cost of care, you came to realize that we were witnessing a battle for the soul of American medicine. Somewhere in the United States at this moment, a patient with chest pain or a tumor or a cough is seeing a doctor. And the damning question we have to ask is whether the doctor is set up to meet the needs of the patient first and foremost, or to maximize revenue. So he really, I mean, this is somebody who's going to rock the boat, which is good, but, he's also not going to alienate people. He's going to say, he appreciates the history of medicine, the innovation of medicine, and the players within medicine.